Welcome to the WRAL Daily Download. I'm Luis Fernandez. A healthcare contract fight could have sweeping ramifications for North Carolinians. Aetna, a health insurance company that administers the North Carolina State Health Plan, and Duke Health, one of the Triangle's biggest healthcare providers, have about a month left to salvage a new contract in negotiations. Depending on how this ends, we could be looking at higher insurance costs or a complete change to existing care. WRAL state government reporter Will Doran joins me now to look at where things currently stand and what's at stake. Will, thanks for being here.
Thanks, Lewis.
So tell me about the contract negotiation. Why now? How far apart are these negotiations? What are the two sides asking for?
So a contract negotiation is completely normal between hospitals and health insurance companies. And, I was looking at in the WRL archives, we cover these, it seems like basically every year. There's always a fight. But this one seems to be a little bit more aggressive than normal, and also with kind of further reaching consequences, in part because Aetna is a huge company. I mean, they have, I think, around 1.5 million customers here in North Carolina, and a huge chunk of them are state employees who work right here in the Triangle who might use Duke. So this is, very targeted at really people in the Triangle, Wake County, Durham County, where we see a lot of state employees living, Johnston County. They could see themselves losing their doctors if they can't get this fixed in the next month. Or the other part is they could see, especially the state health plan, costs rising if they do come to an agreement, but it means the state health plan is paying more money. So there's a lot of moving pieces here, but really important for a whole lot of people.
Yeah, these are two of the largest kind of healthcare companies essentially in the state, with Duke Health and with Aetna. So you mentioned, I think it's important to kind of look at the big picture with this, what has been going on leading up to this. In the event that premiums do rise, this would be the second time prices have gone up in just over a year, correct?
Yes. So the problem that the state health plan sees here for its roughly 750,000 members is that they believe that the amount of money that Duke wants to get reimbursed by Aetna for anything you can think of, primary care, surgery, whatever, is just far too much and would require them to raise premiums again on the state health plan. And now people who've been paying attention might remember that just last month, the state health plan already raised premiums on people, and they put in this sliding scale so that, lower paid state workers aren't going to be paying quite as much, maybe an extra $10, $15 a month for their health insurance. But, people who are higher paid state employees, could be paying extra $50 to $80 to $100 a month under these hikes that have already been approved. So now the chance that there's going to be a second hike on top of that, depending on exactly what happens with these contract negotiations, is certainly not what state workers want to be hearing right now.
Yeah, that could be a problem. For now, though, let's take a quick break. What government officials are saying when we come back. Welcome back to the WRAL Daily Download. We're talking with WRAL state government reporter Will Doran about the contract negotiations between Aetna and Duke Health. So, Will, you've been reporting on this now. Who have you spoken with? What are their concerns about where this negotiation currently stands?
Well, I've heard from all parties involved in this, and Aetna and Duke are both pretty much just sticking to their guns, saying, we are negotiating in good faith. We think the other side is not negotiating good faith, and we are committed to, sticking up for ourselves and our people and our bottom line. So they're, still kind of far apart on this. But again, looking back at how these things go, you often do hear a lot of bluster, and then things sometimes get revolved at the very last second or sometimes don't. And then, they do go out of network for a little while. So, we still have a month or so, but for right now, they are still very much, sticking to their guns. The other party in this, though, is the State Teasurer Brad Briner, and I spoke with him. He is not actually technically part of these negotiations, but he oversees the state health plan, and the state health plan is Aetna's biggest customer. It's about half of their customers in the entire state. So, he has some sway here, even if he's not at the table. His opinion still matters. And he has a lot of concerns with this. He is the one who told me that, yes, he would have to hike premiums again if Duke gets its way. But he's also concerned that, if Aetna gets so angry with Duke that they decide to just walk away, then that's going to mean thousands of state employees are having to choose a new doctor. And so, there's really not a great solution on either extreme if Duke 100% wins or if Aetna just, leaves. He's really hoping for some sort of middle ground solution here, and that's what he's pushing for. And he says that, he's hopeful, but, that hope is obviously diminishing by the day as we get closer to that deadline, which is October 20th for them to figure this out. Otherwise, Duke goes out of network.
What are you spoken on it a little bit there, but what are the worst case scenarios here with this contract negotiation? If there is no deal reached, if things get really out of sorts, what are we looking at as the potential ramifications?
Yeah, I pressed Briner on this, said, okay, you're telling me that you're going to raise premiums. Like, let's put a dollar amount on this. Are we talking an extra $5 a month? Are we talking $50 a month? Where are we? And he said, it's impossible to say right now because, one, he's not privy to all of the financial documents that they are sharing between one another, and two, it does keep changing. They're starting to get a little bit closer to one another. They're still pretty far apart, but they're not quite as far apart as they were at the beginning of these negotiations. So things are in flux. But he said, from what he understands of Duke's proposals to Aetna, it's going to be some sort of hike if Aetna agrees to what is out there now. Could be salvaged, could end up with Aetna agreeing to pay a little bit more to Duke, to cover the cost of healthcare, which Duke says is rising. But it's still a little too early to say exactly how much premiums might rise. But yeah, there's definitely concern for that. And then for, the other side, if people lose their doctors, there is an agreement for people who have really serious health issues that they're dealing with Duke and Aetna. If you're in the hospital, they're not going to kick you out of the hospital on October 21st. You're going to be able to keep receiving your treatment. But, people who just use Duke for their primary care or like an OBGYN potentially, they could be scrambling to find someone if the two sides can't get this all resolved.
In the statements, in the reporting that you've done, two kind of words that jump out: good faith, we've heard that a good amount, and also greed. Is either side just asking for too much here? Like, what's the situation?
Well, look, healthcare is a multi-billion, probably multi-trillion-dollar part of the North Carolina economy. And there's just a whole lot of money for everyone to try to get a piece of. And so Duke is saying, hey, we want a bigger piece of that pie. And Aetna is saying, no, we would like a bigger piece of the pie. So, and of course, us patients are caught in the middle. But this is, really what they're fighting over. You can't really say who's right or who's wrong. I mean, it's just two big companies who are both trying to protect their bottom line. That's what their employees are hired to do, is to make money for the company. So, we're going to see this go on, and there might be some sort of resolution here. But one point that Briner made to me in the interview, he said that Duke is ostensibly a nonprofit, which is true. Duke is a nonprofit organization. You can look up their tax returns and, see how much money they made, all of that. But his point is that they're making a whole lot of money. And, we're talking hundreds of millions of dollars in profits a year. They have billions of dollars invested. And he said, do they really need state employees to be paying more money when they're already making, $500 million in profits or more every year? And what Duke tells me is, yes, we do make profits, but we also turn around and, contribute a lot of charitable work to the area. A lot of times hospitals actually write off hospital bills for people who can't pay them on their taxes. It's called charity care. They do other programs, too, to help out in the community. So, each side has their arguments and their counter arguments. But, yeah, it is a lot of money at stake and a lot of people's lives who could be upended depending on what happens.
You mentioned October 20th as kind of the date to circle to, hey, let's get this figured out by then. What else is coming up next? Is there anything else about this situation that we should know or be following?
Yes. People who have Aetna are going to start receiving letters in the next few days telling them about all of this. So, you heard it here first on our podcast. But if you have family members who get these letters, who are state employees or who are other people on Aetna, this is what it's about. It's basically telling them, hey, there could be a change in your provider. We're trying to get it figured out, but we just want to let you know that it's a possibility. Those are probably going to go out either late this week or over the weekend into early next week. So, people should definitely be on the lookout for those. If your loved ones get those and are scared about that, then this is the context that they're receiving that information in. So just to warn them that this fight is happening and definitely not resolved yet.
And as we get closer to perhaps a resolution, perhaps not, be sure to follow all of Will's reporting as well as the NC Capital team's reporting on this and all the other good things you all do. So that's WRAL State Government reporter Will Doran. Will, thank you so much.
Thank you.
I'm Luis Fernandez. Thanks for joining us, and thanks for listening to the WRAL Daily Download and for making us part of your morning routine. Another great way to get WRAL news is the Morning Briefing newsletter. It's a daily email with Triangle news, events, and headlines to help you get ready for the day. Sign up at WRAL.com/newsletter.